Hello, everybody. Thank you so much for joining us for part one of our chronic pain empowerment series entitled Motivate to Move, a Pain Dilemma. Before I get to the introductions, I just want to take a moment to acknowledge the unceded land that this presentation is taking place on. So we live and worked in Mi'kma'ki, which is the unceded ancestral territory of the Mi'kmaq people. Some others attending this presentation are living in Anishinaabe-Waukee, Haudenosaunee, and Mississauga. I hope that we can take this moment to think about how we can pay our respects to the land we're on and its original caretakers, wherever we may be listening from. So my name is Sam Firth. My pronouns are she and her, and I'm a registered dietitian at One-to-One Wellness. I have experience with a variety of different areas of nutrition, both in inpatient and outpatient settings. Here at One-to-One, I've been enjoying learning more about how I can help people living with chronic pain from a nutrition perspective. And I'll be diving a little more into that in part two and mostly just moderating the discussion tonight. And my amazing colleagues, Tyler and Cecilia, will be taking most of this presentation on. So Tyler Dillman is a registered physiotherapist, and he's the owner of One-to-One Wellness. So his pronouns are he and him. Tyler's interests lie in chronic and complex pain management. So he's a really great person to be chatting with you all tonight. As is Cecilia, who is a registered psychologist who works in private practice and is actually joining our team in the new year as well. So Cecilia's pronouns are she and her. She does trauma-focused work and has experience working for a long-term pain clinic. So like I said, she's also a great person to be talking to you guys tonight. So we're the team behind the series, which was created to show how pain management involves an interdisciplinary team. We work together to help clients manage their pain, but pain management is also a very client-centered activity, meaning you need to learn about your pain and how to manage it with however is best for you at home as well. So this is where the health empowerment model, which we're going to talk about a little bit more later. Yes, right here. So this is where the health empowerment model comes in. So this entire series of webinars, part one and part two, are based off of this health empowerment model. We're going to be focusing mostly on mindset and movement tonight. Okay. So I'm guessing many or most of you, if not all of you, either live with chronic pain or know someone who does. I know for sure that everyone attending has probably felt some sort of pain before. So we just wanted to start off with a definition of pain. So it is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Chronic pain specifically, which is what we're going to be focusing on in this series, is when the pain lasts longer than 3 months. So sometimes chronic pain can occur without a known cause, after an injury has healed, and after a condition has been treated. And the World Health Organization now recognizes chronic pain as a disease and not just a symptom of something else. So I am going to hand the floor over to Tyler and Cecilia now. And if anyone has any questions as well, just type them in the chat box and I'll be going through them afterwards.
Okay, so off to the first part of this series. And I'm going to be speaking a bit about the mindset part. So in essence, the psychological impact of pain. And the first step that we're going to try to embark on is trying to understand pain. What is it? How does it show up in our bodies? And what is it trying to help us with? So the brain, as part of our nervous system, has one primary goal, and that is to keep us alive. And in order to keep us alive, it also needs to figure out how to prevent bad things from happening to us, and especially bad things from happening again. The brain doesn't want bad things to keep happening to us. It's not good for survival. pain comes into the picture as the system that through evolution has developed in our bodies to sound the alarm. It's the threat detection system of the body. And maybe some of you can relate to that. When you have pain, it's very difficult to concentrate on anything else. It really pulls your attention in and directs it towards the area that hurts. And the function of that evolutionary, we imagine, is that if my knee hurts, I'm going to pay attention to it, start examining it, figuring out, is there a problem with it that I need to take care of or try to solve? So that's often what happens with short-term pain. However, the nervous system, including the brain, is also the place where signals, not only of physical pain, but also emotional pain and stress travel and are remembered. So we're going to see a little bit of the overlap that can happen when we have maybe a pain that started from a physical injury, starts to also move over into areas that have a lot to do with stress, anxiety, fear, anger, and other feelings. If you're interested in a story about these types of things, I can recommend going on YouTube and typing in the name Lorimer Moseley. He's a physiotherapist from Australia who's a great storyteller and who tells a story about when he had a snake bite and how pain interacted different ways in different times he was out walking in the bush. So I can really recommend that one. Short-term versus long-term pain. When we start having long-term pain, often what happens in our nervous system is that the neurons, the nerve cells, they're firing so often because they have so much pain to signal that they start to become overactive at times. So they get easily triggered and they send a lot of pain out into our awareness. And that's part of some of what you might be working with your clinicians here at One-to-One, is to try and regulate that overactivity, understand it, and how to work with it. Another thing that we often see if you do a brain scan of someone who has had pain for a long time is that the regions of the brain that deal with short-term pain start becoming less and less active, and instead that activity moves over to brain regions that usually deal with anxiety, fear, anger, and other feelings. So the link between how we feel emotionally when we have pain and how we interpret our pain are quite strong. So trying to answer this question, what is it my body is trying to tell me now, a number of months or years into having pain, can be quite difficult. It's not a straight line between A and B. It's not I bumped my knee into the table, now my knee hurts. It's more different types of signals and more complex things that are going on at the moment. So interpreting your body signals can start becoming quite difficult. Trying to look out for a different type of logic, or trying to see what could be the ways that my body is trying to signal some kind of need to me now, can often lead us a little bit forward on this journey. One way could be to be curious about the context. What does this pain, in what context does it show up? What impact might it have on my life? If I am a pianist, for example, having pain or injury in my hands is maybe something that's very threatening to my financial stability or my ability to do a job that I love. Versus if I'm a wildlife guide and I go on hikes all day, my hands can be so and so, but my lower back and my knees and my feet need to function really well. And then if I get pain in those areas, that start to take on a different meaning for me and produce more fear. As I mentioned before, the overactivity in the nervous system, the neurons becoming more sensitive and more easily triggered, can often explain this, where there was once maybe a physical injury that started off the cycle. Maybe that has healed, but the pain is still there, or the pain is traveling to other parts of my body and it can be really difficult to explain this to your family members or your friends, or sometimes healthcare workers also don't know enough about long-term pain to understand that it's real pain, but it's not connected to something that we can see on a scan or an X-ray. As I mentioned as well, stress, anxiety, fears can start interacting with pain. So if I'm the pianist and I notice the pain in my hands are starting to get worse, I can get really panicked about it. And then that feeds into the stress in my body and can make me feel a lot worse. Self-compassion is also an interesting approach. So I'll mention a few times in this presentation. Often we approach, just spontaneously approach our fear and our pain with some type of judgment. We don't like to be in pain. We don't like that we feel the way we're feeling. We try and make it go away. It's very understandable. Often when that doesn't work, we still try with the same and we get more and more frustrated, and we can start being quite judgmental on ourselves, or maybe other people in our environment don't understand and they encourage us to just push through and do better next time, and it doesn't really work. It produces more stress. So self-compassion, not as a way of trying to feel differently and be happy about the situation, but as a way of being kinder to ourselves, can often start regulating and soothing some of that overactivity. And we'll look into a little bit more of that later. So the psychological impact of pain. One big word that I want to introduce tonight is seemingly a big word, at least, is trauma. And I work trauma informed, so it's a special interest of mine. But it's also a word that often we use in like quite serious terms, that we think of maybe a natural disaster or an attack or an abuser, and that this one big singular event that was very threatening. Myself and other trauma-informed practitioners often work from a definition of trauma that is much more wide and can encompass a lot more different types of experiences. So I've just written here that I see trauma as a spectrum of experiences that my body has had that were overwhelming in some way, were stressful, where I had no choice or very little choice or control over what was happening. So this could be one big event that happened. It could be a series of small events, but maybe times when feeling my feelings was not possible. Maybe the person I was trying to express my needs and my feelings and my opinion to was not receiving it very well, or they were in a power position, like they were my manager or something, and it wasn't safe to express it. Interactions with healthcare can be one of those situations where I'm depending on my family doctor to send me referrals, but they don't fully understand what's happening. So I'm leaving the office of my doctor with a lot of feelings inside that I wasn't able to express. Having pain for a long time and having it affect my capacity to function, to play with my kids, to do work, to do the hobbies that I enjoy, can also be something that has that overwhelming, stressful, little choice and control impact on me. So it's also something, for some people, pain can start with a trauma. We tense up a lot when we have psychological trauma, so that can impact how our muscles are able to function. But just having pain for a long time, even if it started with a physical injury, can also, in this definition of trauma, be traumatic. And ways we can notice this, for example, is we start to notice we get more easily triggered, we get angry, fearful, we're very sad. And both from the nervous system being overactive, but also from the impact that pain is having in our daily lives. It can also be good to know that often people with long-term pain experience an impact on concentration and memory, from the brain just streamlining basically what it's able to pay attention to. Concentration and memory gets kind of put to the side, and also there's a lot of stress hormones that we're experiencing, but that's also something that can heal over time. So what can we do from a psychological angle? What are the different ways we can support our minds? One word that can be interesting if you haven't heard it already to just go online and search and learn more about is neuroplasticity, which basically means that just like if I have a wound, a cut on my hand, it will heal eventually. The brain works in a similar way. Up until maybe 2 decades ago, researchers thought that the brain cells we had when we were born were the brain cells we had, and then they just got fewer and fewer as we aged. But that's not the case. We can heal structures in the brain as well. And different ways of providing the environment for that to happen is to trigger our parasympathetic nervous system. And Tyler will talk a little bit more about exercise from this angle. Sam will mention nutrition. And I'll just have a brief list here of how we can invite this relax and recover activity into our nervous systems. It can be something that happens very rarely when we have a lot of pain. Some people enjoy visualization exercises such as meditation, mindfulness. It can be good to mention that meditation does not have to look like it does here in the picture, where you sit on a pillow on a floor, cross-legged and closing your eyes. It can be many, many different things. It's more about the state that your body enters. So walking meditations, going for a walk around the parking lot or in the forest, noticing how we put one foot in front of the other, things like that can be something that works really well for people. Sitting on a bench, watching a leaf and just noticing all the color shifts, the different shades, the outline of the leaf, things like that, to just start inviting a more grounded presence and a sense of being in the here and now. It can be good to do together with a practitioner, because also we might become more aware of the pain signals as we're doing these things as well. And that's down there at the mind body focused psychotherapies that I work with, where we're inviting the reconnecting the mind and body together again. Often people with long-term pain have had to disconnect to some degree to be able to go to work and pick up the kids at daycare and things like that. We can't be aware of the pain all the time. It just gets in the way too much. So reconnecting to our bodies, but in a safe environment where we also can help the body heal and process some of what it's been through. Occupational therapists are really cool when it comes to working with the activities. So down at the bottom here, I've mentioned some of what they can help with. Identifying what are the activities that I'm currently engaging in the workday. Am I running to the bus? Am I working late? What are the things that I'm doing to try and cope in life? What am I doing maybe too little of that could invite some of this parasympathetic nervous system activity back into my life? Maybe rest looked a certain way before I had started having pain, and maybe rest looks differently now, but that might be something too that I need to discover, and I need some support from clinicians to figure out. So to kind of give some cliffhangers here before handing over to Tyler, some things to explore further. Self-care, self-compassion can be a big theme. Many people don't think of boundaries as a way of doing self-care, but in my experience, it can be a really big part of it. Setting boundaries is also something that can be very difficult to do. We have different histories from our families and workplaces and schools that we encountered in our lives that may make boundary setting a bit more challenging. So learning how to do that in a way that works for me is also something that can be really helpful. Another occupational therapist thing, the pacing or goal setting for a bad day. trying to stay under threshold from triggering a pain spiral. Tyler will talk a little bit more about these yo-yo activity patterns. Can be really helpful and can also be very difficult because it has to do a lot with acceptance. And that can be a big tricky word too. A lot of times you might have heard acceptance used as a synonym to giving up, for example, and we might have felt very strongly about that, very understandably. Acceptance, in my experience, can have a lot to do with breathing. This is my current capacity. It's not where I want it to be, and that sucks. How can I find a way of embracing where I am now to some degree so that I start getting a little bit of a surplus every day and start rebuilding and recovering some of that capacity that I have currently lost? So finding everyone's journey is unique, finding different ways that work for you, finding people to support your journey, whether it's healthcare professionals or people in your home and your environment. A lot of things can be done. Tyler.
Agreed. A lot of things can be done. Thank you, Cecilia and Sam. And Cecilia, thank you for just laying such an important foundation for starting to explore movement and exercise. There's so many key points that I'll loop back into as I get going. And I think I'd like to just start with saying living with pain is very hard. There's so many different factors that come into play, and what I'm hoping, one thing I'm just hoping for anyone that's watching this at any point is trying to get an understanding of how can we maybe just start with movement, something that's so important, and building up tolerance to activities to be able to do some things that we just enjoy, because that's what it's all about. It's just doing some things that we truly love to do. So that's what I'm hoping some people can get out of this today. And so what I'd like to start with when looking at how do we even start exploring movement, looking at kind of the foundations of movement from a pain perspective, right? And what happens when we're in pain, and how do we move? And when we're looking at an acute pain setting, when you look up at the top of this triangle, we get a withdrawal response, right? This is automatic. This happened. It hurts. It's a perception of something that is not safe, and so we move away from it very quickly. And so when you're looking at an acute setting, such as a sprain or a strain of your ankle, or acute low back pain and rotator cuff injuries and those types of things, you get then into the bottom right of this triangle, and that is more of our protective response, which serves an absolute purpose during these acute settings. We have to protect our body and that area of our body, to allow those tissues to heal. And then as the healing process starts to occur, we are able to move a little bit more into kind of like this type of corrective movement. So for instance, a sprained ankle, it might be one of the easier ones to kind of explain here. But sometimes you'll start and just by limping, right? And then you start to, though a couple of weeks go on, you just can walk a little bit more and a little bit more and a little bit more. And then the pain response eventually kind of goes away, and we're healed. But what can happen sometimes, and especially in some chronic pain situations and long-term pain situations, is that we can get really stuck in this loop of movement of either over protection, so this bottom right, or in a state of overcorrection, so we're doing too much. It's really kind of this Goldilocks principle of trying to find that balance, right? And so that overprotection, what we often see leads to things of just becoming fearful of movement and activity because of pain, and also the overcorrection we lead to, which we'll allude to a little bit more on my next slide, is this kind of boom and bust, which both lead to a little bit more sensitive nervous systems over time. And so trying to find that delicate balance is challenging, especially as the longer that pain goes on. So I find that's just a really nice way to try to understand where we're at in kind of that movement perspective. Are we doing a little, maybe not enough, or are we maybe doing a little bit too much? And how does our body respond, and how do we hold ourselves is really important. And so what we see, and going back to Lorimer Moseley, who Cecilia had brought up there, wrote a great book a while ago, Explain Pain, that they just really changed how we approach pain, especially in the physiotherapy world, and bringing up this concept of pain science and normalizing it, which is phenomenal. What we see here is, if you more at this top graph here, is what we see when people get into this overprotective state, right? And so the dotted line going across is the onset of pain. And so what happens is, when people start to feel their pain, they don't want to do as much activity, right? And so what we see is that onset of pain just becomes a little bit easier and a little bit easier and a little bit easier over time, and things just become a little bit more sensitive. And then it just doesn't make sense for us to be moving at that point, because everything that we do hurts. We try to do something, it hurts, and my body's telling me no. Why would I do that? I have pain. And so that is something that we have to challenge a little bit. And then we also get into a different perspective of this boom or bust, right? And if some of you have been through some pain clinics, or some occupational therapists are really good at speaking about this as well, is really, you just go over the tolerance line again and again, and what often happens is it leads to just this flare up, right? You're feeling really good, really good. I have energy today. My pain level's a 2 out of 10. And so I'm going to get everything done. And then all of a sudden, it's just like, oh, wow, that was a lot. And then it leads to a flare up over the next maybe 2 days, 1 day, could be a week, 2 weeks, maybe months. And then you kind of feeling good again. It's like, boom, whoa. And you kind of go through this cycle that leads to just a little bit of activity tolerance over time. And so ultimately, what that comes down to is kind of that pacing and energy management is really important. But we also have to use those types of principles when we're looking at kind of getting into and exploring movement. And the power of just movement and body awareness and somatics is not only it can start to increase our tolerance, but it also serves as that moment for us just to kind of check in with our bodies, of how we're doing and how we're feeling and where that tension is. And as Cecilia mentioned, it can be one of those meditative experiences, and even just kind of little micro meditation of how your body's feeling at that time. Movement can do a lot of things for that. And so I bring this picture in mostly because I think it looks cool. But when this is the nervous system in a very simple form. And as you can see, like it's complex, right? There's a lot of moving parts here. And what's beautiful about it, though, is it shows very clearly, I find, how connected our body is. And that is such a very important understanding when we're starting to come up with a movement strategy that works for you. right? And so what this allows us to do is say, you know what, I understand you've been feeling this pain in your back for so long, right? But we can't go to your back because the tissue is very sensitive, right? And we're more likely to be causing you to get into kind of maybe those boom or bust states, or creating a fearful experience to not want to explore this movement anymore. So if we're able to move a little bit further away and have that understanding that we can influence that area and build up tolerance to the area that we're experiencing most of our pain in, then there's room for improvement there. And so what are some starting points with movement? Cecilia brought up a really good point with even the visualization, right? The visualization of movement can go a long way. And then when you kind of get into more of the active movements, it can be challenging. I'm not going to lie, and it can be fearful. It can be really scary. Again, when you're in pain and you feel like your body's telling you not to move, and then you have somebody that's trying to just say, you need to move, right? You need to move. It doesn't make sense, right? But finding a safe place to do that, and finding somewhere that you're heard, and making a very realistic movement and exercise plan that really works for you is so important. And one of the key things that to keep in mind is this principle of edge work. And it's so important. It's so important. So when you're exploring movement, or even exercise, which I'll discuss a little bit later, going to the edge of your pain, or perception, or even anticipation, or the fear that pain is coming on, is your starting point. Okay, we don't want to plow through that feeling and that sensation and that fear. What we're really trying to do here is prove it wrong. We're trying to prove that wrong, right? That anticipatory response that this is going to hurt, or we're trying to say it's okay, right? And what we often sometimes see is that maybe the pain doesn't change, but the range of motion does. So you have a little bit more room to move without flaring anything up, which is so, so important. And so an exercise that I often begin with is one of the one pictured here, which is called feet in and out. And what I like about it, it starts far away, right? If say somebody's coming in and experiencing back pain or mid back pain, starting far away and understanding when you go back to that nervous system that it's connected, we say, okay, move your foot in. And if you feel safe to do so in your environment right now, just give that a try. Just if you're able to straighten your knee, try moving your foot in without moving your hip, right? And explore that sensation. How does that feel? Does it feel safe? If it feels safe, it's not triggering any pain, you're not getting any anticipation, any fear, you're not holding your breath, you're not noticing any extra tension, then slowly start to roll your hip in, okay? Again, if you start to feel like, oh, okay, I don't know, you stop. You take a breath. You can then become curious, as Cecilia had mentioned. You can start to bring some logic of, okay, has this changed? Is this fearful? Is this dangerous movement? And if there's answers yes to any of that, then you turn your ankle out, and then you go back to a place of safety, a place of comfort, right? And then you go back, because when you're looking at making changes in the body and this neuroplasticity, oftentimes it's intention and repetition. Okay, we need to repeat that in a nice, safe way without kind of going overboard. And what's really nice about this type of movement is it's quite it's challenging in a cognitive way, right? So it takes a lot of brain power to often dissociate our ankle from our hip, and that's because our brain, when it coordinates movement, it doesn't know muscles, it doesn't know peroneus longus, gluteus medius, these types of things. It knows how to coordinate that pattern of movement. And so we're kind of trying to change those patterns of movement through these types of body awareness somatic exercises. And if this makes sense to you, I'd really recommend YouTubing or Googling Martha Peterson, Thomas Hanna, Feldenkrais. They're kind of what I would say kind of the gurus of this movement practice. And it will give you a little bit more of an understanding of this. And a big piece of movement as well, and exercise in general, is when we're understanding that pain can happen during that process. Okay, pain can happen, and in all honesty, it's expected. There would be some expectation that pain would occur. But what we recommend is what we've seen out of literature of tendinopathies is a little bit of pain is okay. And what we do is monitor that pain. So really you can react that pain, become frustrated. There's going to be emotion. Ugh, why can't I move here? Why can't I do more? Allow that to happen. Okay, allow it to happen, but don't determine if that was a safe movement or activity until about 24 hours after the fact, and you can determine how you're feeling, right? Did my pain level increase? Is it back to baseline now? Because if it is back to baseline, we're more likely, the best route in my experiences is to maintain that level of activity or movement in repetition, in time, so many different factors. Okay, so I'll encourage everybody just to take a nice breath, because I'm going to do so as I shift gears to discuss a little bit more about exercise. So when living with pain, exercise can be one of the scariest words to think about, because of most of us have had negative experiences with it, either before pain, during the treatment process of pain. It has been painful, and there's so many things to think about. But when you're looking at general health, strength training in particular is so important, and it is recommended 1 to 3 times a week, right? And it is a negative physiological event. We do have to create that muscular work and put load on our muscles to stimulate positive and adaptive change. And what we see from a general health perspective, it does wonders. It does a lot for us. And when you're looking at pain management as well, I'll get into a few slides what it can do for us in kind of the short term and a little bit of the long term. But what often goes wrong is the parameters and the dosage are wrong. And so most what you see is individuals have been told to start at a certain point, and it's too much for the nervous system. It's not a safe parameter. It's not a safe starting point, right? And what is the safest place for exercise and strength training is just feel safe with the movement. Feel safe with the movement. If you feel safe with the movement, then we can gradually load it up in one way or another, right? Maybe it's isometrics, maybe it's repetitions, maybe it's 1 repetitions, maybe it's load. There's so many different factors that we can challenge our muscles with. And why is it important? What's the value in it from a pain management perspective? And I apologize, I forgot to cite the paper here. It's out of the British Medical Journal, and so I'll forward this along after the fact. But the value from a pain management perspective, it can reduce fear, right? If it's done correctly. It allows us to experience maybe a little bit of controlled pain during the exercise to reduce that threat. And what we see with a safe strength training or an exercise routine is it can enhance self-efficacy for everyday tasks. And that's really a huge, huge key here is we want people to feel confident in their ability to do things that they truly want to do, right? Strengthening and movement are supposed to reinforce that and make us feel confident. It's not supposed to take us in the other direction, right? So if it is done correctly, you're able to reduce that fear. And in the short term, it has been shown to reduce pain, right? You get your endorphins flowing, you have your dopamine, serotonin, norepinephrine, can all reduce the amount of pain that we are experiencing. And then you add that into just kind of a safe environment in doing so. If you feel if you would like to be supervised, like you have somebody there just saying, you know, does this feel safe, right? Are you still feeling safe? All of that can go a long way. And then we have this concept of conditioned pain modulation, kind of blocking pain with pain. So it can be a bit of a tricky call that we don't want to do too much, especially with sensitive nervous systems, because sometimes that can lead to flare-ups in 24 or 48 hours after the fact. So you get to be really careful and you really want to know how your body responds to the movement and then gradual load and or intensity over time. And if anything, what we've learned over the past few years anyway, having a really solid immune system is so important. But pain is it involves pretty much every system we have in our body, everything, right? So, and immune system function is impacted as well. So we see an immune system boost with strength training and exercise, and so that's really, really important. And again, from a general health perspective, what we see is that we lose muscle mass as we age. It's just part of the aging process. And it's so important to have, not only from just a pain management perspective, but from a health perspective. When we get sick, or there's times that we aren't able to do the things that we want to do, maybe because we're in pain, our bodies use muscle as fuel when we are sick, especially if we have a chronic disease and a chronic illness, or so the healthier that we can be and have more muscle during that time, usually the better outcomes. And it also it can be more preventative as well, which is what we're looking for beyond kind of increasing self-efficacy and all of those things. But I think how to do it, and I think the best way for me to explain this is just the approach that I use, and understanding that this isn't the only approach. We see a lot of health benefits all along the spectrum for strength training, but a very, very good starting point is a very slow and controlled movement when it comes to strengthening. And on the surface, it doesn't really make sense. It's like, you're telling me to strengthen my body, but move slow. That doesn't make sense. But what you end up doing is taking out momentum, and you really reduce acceleration. And when you're looking at what the body often responds to negatively, especially when we're in pain, is really quick movements, right? Really repetitive movements. And so when you're moving really slow, so say I would have somebody on the chest press, and you're going at this pace under load, right? So 5 seconds, 6 seconds in one direction, 5, 6 seconds in the other. There's just an element of control, but you're keeping the tension on the muscles where they're supposed to be. And that can go a long way. And so once you feel comfortable with that movement, then you can slowly add to that, whether it be load, whether it be, I'm just going to do it for a little bit more time, those types of things. And what's what is also mistaken is you can really strengthen your major muscle groups, your 10 major muscle groups with 3 exercises. And that is something along the forms of a leg press or a squat, something along just an upper extremity push, and an upper extremity pull. Okay. And if you do that once a week, those 3 exercises once a week, you are getting the positive health benefits that we want individuals living with pain to get. And it doesn't have to be more than that, especially starting out, because there's so many more things that we have to think about. Is how is the body going to respond? What's the after effect? Was it too much? Was it too little? Did we should have we stopped at this sensation and we didn't? Those types of things can really go a long way. And another important consideration is the recovery time. We often forget that this is with strengthening and just in even movement or daily activity sometimes can be stressful. And what we really need to do is recover from that event, especially in strength training. Going to and strengthening your major muscles is exhausting, and you have to allow all of the energy stores to come back, and you have to allow your nervous system to adapt and say, okay, I'm ready for the next session here. And it generally declines with age, and it is impacted by a lot of things, including stress, nutrition, sleep, genetics, and all of those things have to be really part of the equation when you're looking at, is it once a week? Is it twice a week? Geez, did I sleep well today? Did I have a good sleep last night? Well, do you know what? Maybe I should give another day before I do my strengthening session. How's my nutrition been lately? Oh, well, do you know what? I had a few friends over last night and we had beers and wings. You know, maybe this isn't the day to be strengthening. Maybe I should just give it a day and allow things to recover a little bit more. But it is one of the most important parts of exercise prescription, is including that recovery time in. And a key component for, I find, individuals who I find in the more overcorrective, that boom or bust, the understanding, and I heard this from Shannon McGuire, concussion course she's out of Ontario. Rest is an active part of rehab and recovery. It is so important to remember that, because we often think we have to continue to do more and more and more and more. We have to stay in the gym, but that rest and that recovery period is so important, if not more important than the negative physiological event, especially when it comes to strength training. So that kind of wraps up, in a way, today's part 1 of getting how to start to initiate and maybe find some really good starting points to understanding your pain, understanding how to potentially start a movement to increase activity tolerance, or just explore movement to help recover from your day-to-day and be able to kind of check in with your body, and understanding the importance of just exercise in general, and that it is possible. And the NICE guidelines out of the UK really recommend it, just from any individuals living with chronic pain to be working up to exercising and strengthening. But it is hard, and kind of going back to one of my first statements, living with pain is hard, and sometimes trying to do everything that we're supposed to do is more stressful than just kind of picking one at a time and then just building off of that. And I think that's a really important thing to consider too. And approaches are different. Chronic pain management is different than acute pain management, from many different aspects and how to approach it. Some of the best advice I think I could give is really start really low and build slow. It's the long term here, right? And Cecilia probably knows this way more than I do, just that it's tough. We don't often get that short-term reward. We're actually getting almost a short-term punishment in a way with that onset of pain, but keeping that long-term picture in mind. And then you're going to react immediately to that pain. That's what pain is meant to do. But try to evaluate and determine if it is appropriate movement or exercise. Give it 24 hours. And then we get to determine what's safe and what's appropriate, and when to scale back, and when to move forward, or when to keep it the same. So I think that is all.
Thank you, Tyler, and thank you, Cecilia, as well. I always learn so much from the two of you, because we work together very well, but our focuses are so different at the same time. So I hope everybody enjoyed that as well, and I hope everyone's gonna join us for part 2 next week as well. I'm just gonna check the chat. I don't think we have any questions in there yet, so if anyone has any questions for any of us, feel free to either type them in the chat or unmute if you feel comfortable. Yeah, just a couple of people in the chat saying they'd love a copy of the notes, and someone else said that looks really cool, and I think that was for the nervous system picture, which I agree, it does look very cool.
Yeah, I can absolutely, if anyone wants to email any of us below, we can send the PowerPoint notes along. That's no problem at all. And this will be available on our YouTube channel and our website as well. So in case there's anything that hit home, or if there's just really any questions, this topic is, there's a lot to take in, and a lot to reflect on, hopefully after the fact. So if anyone has any questions after, once you're able to kind of let it sink in, and see how it fits in your life, please feel free to email any one of us at this point. So
yeah, definitely.
Let me see, there's a couple.
Yeah, we have a couple more comments. I like the principle of edge work. I'm aware of Neil Pearson's work. All right. Yeah, that was great.
Neil Pearson is doing some great work out of, I'm pretty sure Pain BC, correct me if I'm wrong there, Pam, but British Columbia is really ahead of the game in what they offer for individuals living with pain, and the group that they have there. It's phenomenal. It's anticipatory pain is, and Cecilia, jump in here, please, if you have anything to add with this. It's very tough, and it's our nervous system doing its job, right? We are predictive machines. We want to know what's happening. We want to be certain. And why would we not want to not feel that again? And but the key thing that I see there is just awareness of that, right? And so you can become more curious of it. What do you think, Cecilia?
Yeah, and often with anticipatory pain, the thing that comes to mind for me as well is to maybe talking to the brain in the brain's language when it comes to the anxiety piece of that, or the fear piece of, I can predict and see that maybe something bad is going to happen if I move this way. I'm already having an anxiety response, which means my brain stem is sending out signals of danger, that it's not safe. And there are so many links to what Tyler was saying earlier as well, that sense of safety. So maybe taking some deep breaths or doing a meditation exercise, some mindfulness or something is going to be, it's difficult to think your way out of that because it feels so real, and it has been real in the past. So those shortcuts like that, it's not about thinking about, oh, I shouldn't be afraid of this, but it's more about how can I help my nervous system be a bit calmer or soothed here, so I get a chance to access my whole brain when I'm trying to evaluate whether or not this is a good activity for me. So really fascinating stuff, and yeah, one tends to learn a lot about how brains work trying to do these kinds of things. It's quite interesting.
Great. Any other questions, comments, discussion points, anything we didn't touch on that anyone was hoping?
Someone else in the chat box said, this was awesome. Thanks so much. I've started doing little stretches and movements every 20 minutes throughout my workday, and I doubted I could do it and stay focused and get things done. And now I realize I was wrong, and I look forward to my day at work because of them. That's so awesome to hear. I'm so glad.
Yeah, it's so important. It's so important. Especially when you're looking at mechanical pain. It's often brought on by being in one position for too long, right? So having those little strategies and those little movements throughout your day, in my opinion, it can be way more effective for pain management than a dedicated 20-30 minute exercise throughout the at night. And sometimes when we're just exhausted from the end of the day, that 20 or 30 minutes isn't even possible, right? And so being able to implement those strategies is wonderful.
Yeah.
Awesome. Okay.
Oh, we have another question. I've been able to work with pain through the edge work, but I struggle with fatigue. Is it the same concept as pain? And someone else said same about the fatigue.
You want me to answer that, Cecilia? Do you want to take that?
Feel free if you
Okay.
want to start. I can.
Sure. In simple terms, without knowing the entirety of it all, yes. Kind of using that same principle with that fatigue and understanding the onset of your fatigue and what brings that on. There's quite a bit of literature now with chronic fatigue syndrome and ME and those types of conditions about making sure that you're just not kind of pushing and crashing into that fatigue as it gets easier to bring that on over time, and it can be a little bit harder to get out of. It's tricky when we have day-to-day things to do, because we do have a lot of things to do, right? And so ultimately finding that boundary of that recovery is really, really important, and what can reduce that fatigue. And then looking as well as, I think, nutrition, sleep, all of those other factors that really can come into play for just overall energy levels if those haven't been explored yet. And Sam is going to touch a lot more on nutrition next week.
Yeah, and it's someone's describing here how can be so hard to tell where the boundaries are when you've had fatigue for a long time. And like you were mentioning, this curve of activity, it can really take quite an investigation, in my experience, together with maybe a healthcare professional who is aware of these concepts, to try and see, well, what is actually, am I getting rest at all? Is it just this half rest state that I enter sometimes, recover enough to keep going? When was I actually feeling rested last, and how can we try and take steps to bring me closer to that again? It's really very common in my experience as well that the recovery piece isn't working, that we lose track of our activities, how they're impacting us, because we're swimming in this a sense of overwhelm almost all the time.
Yeah.
So yeah, discussing it with someone who works in the field. Yeah.
Mhm. So
And-
it looks like oh, sorry, Tyler.
Yes, no, I was just going to add to that a little bit as it kind of sparked a little bit memory, but um, when we're experiencing and when you're experiencing long-term pain, it's taking a lot of our energy and our attention, as Cecilia um, had brought up earlier, and that takes a lot of our energy and can be fatiguing in and of itself. So that's such an important concept here too, and kind of having that understanding of finding those the management strategies there that allow us to kind of have that moment of relaxation and meditation, and those types of things can really help with that too.
Yep, self-care is important.
Very much so.
And difficult.
Yeah.
Yeah.
Yes. Okay. I think we're
Okay.
good.
Yeah, and I want to remind everybody too, just as I remember, to check your junk email for the link to the next part for next week, especially if you had any trouble getting this week's. I know someone did send me a message right before we started saying that they didn't get the link. So just check your junk email if you don't get it, within a few days before.
Yeah, for sure. Okay.
Yeah. Thank you so much, everyone.
Thank you. See you next week.
See you next week.
See you next week.